Avoid castor oil. If you have these health problems, castor oil is a remedy celebrated for its numerous health benefits. But, my friend, as you know, not everything is for everyone. And today's video is crucial for those who might need to steer clear of this potent oil due to certain health conditions. Castor oil, while beneficial for many, can pose serious risks for individuals with specific health issues. So, we'll explore why castor oil is not suitable for everyone and list the health problems that should make you think twice before using it. From liver disease to inflammatory bowel diseases, understanding these exceptions will help you use castor oil safely and effectively. So, if you're ready to learn about the safer side of natural remedies and ensure you're not inadvertently harming your body, stay tuned. This video promises to enlighten you with essential insights that could protect your health and prevent complications. Severe hemorrhoids. For those suffering from severe hemorrhoids, the use of castor oil might not be the relief you're hoping for. While commonly praised for its anti-inflammatory properties, castor oil can exacerbate the condition in severe cases. Hemorrhoids, particularly when inflamed, require gentle care to avoid further irritation. The application of castor oil, especially if used as a topical remedy, can lead to discomfort and potentially increase inflammation rather than soothe the area. If you're dealing with painful or bleeding hemorrhoids, it's crucial to seek treatment options that specifically target the delicate needs of this condition, rather than relying on remedies that might intensify your symptoms. Pancreatitis. For those suffering from pancreatitis, castor oil is generally advised against. The use of laxatives like castor oil can stimulate the production of digestive enzymes, which is problematic in pancreatitis, where enzyme production is already a concern. Increased enzyme activity can aggravate the inflamed pancreas, intensifying pain and potentially leading to a worsening of the condition. Managing pancreatitis often requires medical supervision to carefully regulate digestive enzyme activity, making the use of castor oil inappropriate and potentially harmful. Abdominal pain of unknown origin. If you are experiencing abdominal pain whose cause has not yet been diagnosed, it is crucial to proceed with caution when considering the use of remedies like castor oil. Castor oil is renowned for its strong laxative properties, which stimulate the muscles of the intestines. However, if the underlying cause of the pain is unknown, this stimulation could potentially exacerbate your condition rather than provide relief. For instance, if the pain is due to an undiagnosed obstruction, inflammation, or any internal disorder, the increased intestinal activity triggered by castor oil could lead to severe complications. It is vital to first identify the root cause of your discomfort through medical evaluation before deciding on treatments. Employing a substance as potent as castor oil without this knowledge could obscure diagnostic efforts and delay appropriate care, possibly leading to worsening symptoms. Prioritizing safety and ensuring a thorough understanding of your health condition are essential steps before introducing any form of treatment, especially one as potent as castor oil. Ulcerative colitis. For individuals battling ulcerative colitis, castor oil poses certain risks that cannot be overlooked. This condition, marked by long-lasting inflammation and ulcers in the digestive tract, demands a careful and considerate approach to management. Castor oil, known for its potent laxative effects, can trigger an aggressive stimulation of the intestines, potentially leading to painful flare-ups and increased bowel movements. Such reactions are not only uncomfortable, but can also interfere with the healing process of the colon's mucosal lining. It's essential for those with ulcerative colitis to consult healthcare professionals and adhere to prescribed treatments that are designed to reduce inflammation and promote healing within the gastrointestinal system, rather than experimenting with castor oil, which may exacerbate their delicate condition. Kidney disease. Individuals with kidney disease should exercise caution with castor oil due to its potential effects on fluid and electrolyte balance. Castor oil's laxative properties can lead to significant fluid loss through increased bowel movements, potentially resulting in dehydration and an imbalance in electrolytes which are crucial for kidney function. This can strain already compromised kidneys and worsen kidney function. Therefore, it's essential for those with kidney issues to manage their condition under medical supervision and avoid treatments like castor oil that could potentially stress their renal system. Appendicitis. For those experiencing or susceptible to appendicitis, using castor oil is not advisable. Castor oil acts as a strong laxative, stimulating the intestines and potentially aggravating an inflamed appendix. This increased intestinal activity can exacerbate symptoms or even precipitate a medical emergency by causing the appendix to rupture. Therefore, anyone with abdominal pain that could be indicative of appendicitis should seek medical evaluation immediately and avoid any laxatives, including castor oil, until appendicitis is ruled out. Liver disease. For individuals suffering from liver disease, using castor oil necessitates considerable caution. Castor oil is metabolized by the liver, and its active compound, ricinoleic acid, can be particularly burdensome on a compromised liver. In conditions such as hepatitis, cirrhosis, or other forms of liver impairment, the liver's ability to process and detoxify substances is significantly reduced. Introducing a potent laxative like castor oil can overburden the liver, potentially leading to an exacerbation of symptoms and a further decline in liver function. The increased metabolic demand can cause toxin buildup, worsening the overall health of someone with liver disease. It is vital for patients with liver conditions to manage their symptoms under the guidance of healthcare professionals and to opt for treatments that do not place additional stress on their liver. The priority should be on stabilizing liver function and preventing further damage, rather than risking the potential side effects of castor oil. Gallbladder disease. Individuals with gallbladder disease should be cautious about using castor oil. Castor oil stimulates the smooth muscles of the digestive tract, which includes the gallbladder. This stimulation can lead to the contraction of the gallbladder, potentially causing pain and complications in those with gallstones or other gallbladder disorders. The movement could dislodge stones, leading to blockages or acute attacks. It's important for those with gallbladder issues to seek treatments that do not provoke gallbladder contractions to avoid exacerbating their condition. Anal fissures. When dealing with anal fissures, a condition characterized by small tears in the lining of the anus, which can cause significant pain and bleeding, particularly during bowel movements, it's important to avoid castor oil. While castor oil is often touted for its moisturizing and healing properties, its use as a laxative can actually be counterproductive in the treatment of anal fissures. The laxative effect of castor oil can lead to increased stool frequency and softer consistency, which might seem beneficial but can aggravate the fissures by causing repeated stretching and tearing. This can interrupt the healing process, leading to prolonged discomfort and possible complications. Instead, treatments should focus on gently healing the torn tissues and managing pain. Medical professionals typically recommend topical treatments, increased dietary fiber, and sometimes even surgical options for severe cases. Introducing castor oil into this delicate equation could hinder recovery, making it imperative to choose targeted, medically approved treatments that specifically address and support the healing of anal fissures. Skin disorders with open wounds. Applying castor oil to skin disorders that involve open wounds is highly discouraged. While castor oil is celebrated for its anti-inflammatory and antimicrobial properties, which might seem beneficial for skin health, its application on open wounds can be problematic. The thick, viscous nature of castor oil can create a barrier over wounds that might trap bacteria or debris, impeding the natural wound healing process and potentially leading to infections. Additionally, the moisture-retaining properties of the oil can maintain too much moisture in the wound area, disrupting the delicate balance needed for wound healing. For effective management of open wounds, it is crucial to follow proper wound care practices that promote drying and healing of the wound, such as using appropriate dressings and possibly medicated ointments as prescribed by healthcare professionals. The use of castor oil on intact skin may support skin health, but its use on open wounds should be avoided to ensure safe and proper healing. If you found this video useful, consider liking it and sharing it with friends and family. You never know who might benefit from this information today.